Good afternoon. I'd like to welcome all of you who are watching or listening at home. Before I speak in more detail about the Nightingale Hospital at Millbrook, I want to provide an update on our healthcare position and the most recent statistics on testing and treatment. So as of today, we've tested 2,192 samples for COVID-19 and have received 1,880 negative results and 249 positive results. Of those with positive results, 42% are male and 58% are female. The average age of those who've tested positive is 54. And we are currently awaiting the results of 153 outstanding tests. I am pleased to report that 118 islanders have fully recovered from coronavirus, having originally tested positive. 45% of those who've recovered are male and 55% are female, and their average age is 45. Sadly, despite this positive outcome, 14 islanders have passed away, having tested positive or been suspected of having coronavirus. And as an island, I know we mourn their passing, and our thoughts remain with their friends and families. It is no less saddening for me that many had underlying health conditions or were elderly. And we want to protect and save as many lives as possible, and we continue to have good capacity to treat islanders in hospital. So there are currently 63 islanders being treated in the Jersey General Hospital for a range of medical conditions, and of those, 14 are coronavirus patients. As of 8 a.m. today, we had a total of 134 beds available in the hospital, giving us an occupancy rate of 32%. Now, both I and the Coronavirus Hotline have received many questions about Jersey's temporary Nightingale Hospital at Millbrook, and I hope that I can answer some of those questions now. Now, the answers to these and many other questions are also on gov.je/coronavirus, and that page has been updated over the weekend to make it more user-friendly. And if you want a regular update, you can actually get one by emailing coronavirushotline@gov.je, and you'll be added to the mailing list. So the temporary hospital was designed to prevent our healthcare facilities from becoming overwhelmed, and it enables us to provide medical care to those requiring oxygen but not invasive ventilation. And the benefit of what they call the Nightingale layout, which is 2 rows of 15 beds in a ward, means that we can staff it with registered nurses who can see all the beds from a central location. And that means our nurses can work at their most efficient, enabling more patients to be cared for by fewer staff. And in building the hospital, this was actually one of the main objectives, which was to ensure that we didn't add to the pressure on staffing numbers in our health service. And that was a deciding factor in choosing Millbrook playing fields. Now, many questions I've received have been about why it was selected over other sites, including, for example, Fort Regent and the RJNHS. So the initial site selection considered 16 locations against a range of criteria, such as the size of the facility, its basic infrastructure, the topography of the locations, the accessibility to key services, and, importantly, rapid access to the general hospital. Now, some locations, like the Fort, could not accommodate the Nightingale layout. Some locations, like the RJNHS, were simply not as good for rapid patient transfer, and some had other issues. So, for example, People's Park had a slope on it which would have prevented work starting immediately. Millbrook met all the criteria and enabled us to start work very quickly with minimal disruption. Now, the progress so far has been fantastic. The shell has been completed and work has already started on the interior. And the project team is led by Growth, Housing and Environment in partnership with Health and Community Services. And the contracting design and delivery team are led by J3, which is a consortium of local and UK construction firms. They are using local contractors and support from the military as required. And I want to say we're very lucky to have expert advice from J3 because their direct line into Nightingale projects in the UK has been invaluable, ensuring our team learns from all the work that has already taken place over there. And we also receive support from Ports of Jersey and other government services. The building team, which is called Neptunus, who came to Jersey from the Netherlands, completed the initial construction work in just 8 days and have now returned home to their families. While they've been here, they've lived together, separate from anyone else, to reduce the risk of any transmission, and have worked with a pace and precision for which I wish to thank them. Their fellow workers, who gave them a guard of honour as they left the site, are continuing to work at a pace which, if anything, has increased. And again, I want to thank them all. And I want to reassure you that our decision to build a hospital considered any potential risks to islanders, including the impact on nearby residents. Our Nightingale Hospital will adhere to the same standards expected of any controlled clinical environment. And this includes the management of hazardous waste, and our air filtration will be more rigorous than that used in other Nightingale hospitals in the United Kingdom. There is no evidence to suggest that the wind direction and speed, for example, has any bearing on the spread of COVID-19. And the hospital environment will be decontaminated very regularly in exactly the same way as we do in the general hospital. And it's important to remember that COVID-19 spreads through large respiratory droplets generated from an infected person's coughs or sneezes. These are heavy and they quickly fall to the floor. And that's why we ask people to keep 2 meters apart from one another when outside their homes. So you'll be aware that the Nightingale Hospital is a temporary structure, and at present we anticipate that it will be operational for between 4 and 6 months. And while we all hope there isn't any need, there is also an option to extend its use if necessary. Now, it will take a little time to dismantle the hospital when it is no longer needed, but at that point, Millbrook playing fields will revert to their original use. Now, the total cost of the development is approximately £14.4 million. £1 million of that is for the structure of the building and its rental. The fit out and design is a little over £6 million, and other costs, including medical equipment, much of which will be reusable following the dismantling of the Nightingale Hospital. So, for example, the oxygen generation plant is just one of the assets that we will continue to use after the pandemic is over. The overall cost of using an existing building would have only been marginally different, and, as I've said, existing buildings did not fulfil key criteria such as the speed of transfer to the general hospital and minimising the pressure on clinical staff. Now, when it comes to the day-to-day operation of the hospital, health colleagues are presently working on staffing arrangements and will be able to confirm the numbers of nursing and support staff shortly. There will be some operational and logistical impacts on islanders. So patients will be assessed at the general hospital before coming to the Nightingale Hospital via ambulance, and the entrance on the avenue will be widened to accommodate them. The inner road entrance will be primarily for staff. Now, also know that the current closure on the inner road has caused some concerns, but it did have to happen immediately, which was to allow the hospital to be connected to electrical, water and drainage services, but that should last for about less than a week. Now, I want to thank everyone for supporting the project and for accepting the need for rapid decision making on the site and its construction. And we've had many offers of help from contractors to get involved in the project, with local companies offering their services for free or at cost. This is actually an exciting project and a full team effort from nursing to construction. The way that the local community have responded to this is fantastic. The team are getting gifts of cakes from schools and the church, and the parish and its political representatives have been wholly supportive. My thanks especially go to all the local residents who are coping with this immediate change in their own neighbourhood, and their parish representative for supporting their communities during its construction. This hospital is a critical aspect in our overall strategy to prepare the island for a peak in coronavirus cases, to protect the most vulnerable and to save lives. But also this week, I've instructed officials to start looking ahead and to focus on our strategy for when health officials can recommend the lifting of restrictions. You'll have seen some countries around the world have already begun to lift restrictions to allow certain movement between work and home, and certain businesses, like takeaways or corner shops and electrical stores, to open. Now, that latter position actually reflects the current position that Jersey is in today. And we will look carefully at our data over the coming week and the positive impact we are seeing thanks to your great cooperation with the stay-at-home measures. With that information and with the advice from medical professionals in place, we will then be able to start publishing our plan. Thank you very much for listening, and I'm now happy to invite questions from the media. And so for the purposes of those listening, hopefully we've got Alex Watson from Channel 103, we've got Fiona Potney from Bailiwick Express, we've got Elisa De Silva from BBC Radio, and we've got Johnny Jury from the JP. We do not seem to have anyone from Channel TV at the present. So what we'll do, I think in the same format as previously, is we'll go round once, 2 questions each, and then hopefully do one wrap round at the end and then see where we get to. So if we start off with Alex Watson from Channel 103.
Chief Minister, can you hear me okay? Thank you, Chief Minister. Can you hear me?
Yes, we can hear you.
Fantastic. So on Friday, you said that 7 more invasive and 10 more non-invasive ventilators were coming, bringing the total up to 31 and 29 respectively. I was just wondering if there's any updates on when they'll be here and which hospital sites they'll be deployed to.
Right, in terms of the sites, and bear in mind, I'm not the technician on this, my understanding is all the ventilation side will take place in the general hospital, certainly at the invasive level. In terms of the exact delivery date of the machines, I haven't got an update with me now, but obviously as soon as I've got that update and as soon as they are on island, and we've not had any negative remarks to date as to any delays in that time, I'll be delighted to be informing you and the public.
Fantastic. And
hang on, you've cut off, I'm afraid, the second question.
That's all right. Sorry, today we've seen the UK launch its payroll funding.
Sorry, we can't actually hear you. Try again. If not, we'll go to Fiona.
Go on, hang on, let me try and get
That's
a bit closer. So the UK has launched its support today, promising payment.
No, sorry. We'll try again in 1 sec. We heard the beginning of that and then lost you completely. So we'll do Fiona for 2 questions and we'll come back to you. Fiona.
Thank you, Chief Minister, for that update, and thank you for agreeing to do more press conferences. I'm sure that's greatly appreciated by all the media and the wider island as a whole. So just to pick up on a theme that I brought up with you last week, when I asked you about the topic of lockdown, I know you haven't had your formal meeting this week about it, but you brought up the antibody tests and how, in your words, they would inform and influence the approach going forward. Now, we know that the World Health Organization is advising against the use of such tests outside research settings and is saying that they shouldn't be used as the basis of public health decisions. We also know that the UK's testing chief has said that these sometimes only work in cases of severe symptoms, and so that's why the UK is backing away from so-called off-the-shelf testing kits. So those that are...
Oh, well, she's just frozen. We got to the so those, and then you froze, I'm afraid, Fiona.
Apologies. Where did you get to, may I ask?
You got to so those, and then you froze. You were about to actually put the question.
Okay, so we know that, I'll just repeat myself, we know the UK's testing chief said the UK was backing away slightly from relying on antibody testing. Can I ask why, with this in mind and with the WHO guidance as well, has this been made a key part of the strategy going forward? And can you also confirm, we know that HealthGen is one of the providers, but can you tell us the provider of the 150,000 kits that are also on their way?
I don't have the name to hand. I can try and I have got it on a piece of paper with me that we were briefed on a couple of days ago. I'm afraid I don't necessarily retain the information. I just know where to look it up. In relation to the overall principles on antibody testing, as I've understood matters, I do emphasise that was Friday, and obviously we're Monday. Is that from our perspective, what I've understood is there are sometimes concerns around the quality of the kits, and that is why it is important that we are doing our evaluation coming through of that's on the 50,000 that have come from the HealGen side. That's the ones that have come from a US supplier, but also are produced in China. and so we need to make sure that they are working in our own context. My fundamental understanding on that is that it is critically important that the tests are performed by medical staff and are done in a laboratory environment. And I believe that's part of that evaluation that's being done. And as I've understood matters, is that the testing would be done by medical staff or people trained in that process rather than being a self-testing regime. And that's one of the things we are trying to get in within the evaluation. Now, if that advice has changed formally in the last few days, we've not had an update on that. Certainly, our officers, and they are being advised by the medical staff here, what I've just said is what their advice is to us.
Okay, just to follow up on that theme before I move on to my next question, can I just check with regards to the tests themselves? We know that the HealGen ones, the information is available online. There's been various tests of them in terms of their accuracy, and this seems to vary wildly. So them are saying they're getting 61% accuracy, others are in the 80s, some are around the 90% mark. What is the government going to consider as a acceptable level of accuracy for these tests in order for them to be used on the island?
Well, I think that's where the evaluation process that they're running here. So without commenting specifically on the HealGen, because that evaluation is taking place, I do know that some other equivalent tests were evaluated earlier. And so, for example, one product that we didn't go for, there was some issues around cross-contamination, which therefore that affected the results. I suspect, please note that's as a layman, I suspect that might be one of the reasons with the caution that's coming out of how you use these. Although for us 100,000 is quite a large number, in terms of every other jurisdiction, it's quite a small number. Therefore, one would hope that we can actually get the systems in place that essentially compensate for some of the issues that you're talking about. I think the crucial thing, as I've been advised to date, is around making sure it is done in the laboratory, which obviously we have our own on island, and it is done by the medical staff. That's the advice we've had. To date, it hasn't changed, but we are getting updates on a regular basis. I'll stop there. You want to go to your second question?
Yes. So I was sort of looking into Jersey's response to previous pandemics. So if you look at the H1N1 flu that took the island in the 2000s, Jersey was praised for its response to that. One of the key things there was it stocked up high on levels of vaccines, antiviral drugs. Central to this was securing pre-purchase agreements with providers in order that it could get hold of those as quickly as possible. Can you tell me what pre-purchase agreements Jersey already has in place and which ones they're still looking to get together for this?
Well, I think obviously there isn't a vaccine, so we haven't. I think everybody's in that same position, and we obviously don't know whether that's 6, 12 or 18 months away. In terms of things like PPE, we did have some stocks, for example, for pandemic and for Brexit, actually. And although that's not a separately identifiable reserve, that was a buffer. And obviously, as we take stuff out of that, more orders are coming in which replenish that buffer. I think that's probably the simplest way to put it. In terms of other matters, I'd have to revert with some detail. What I will say is that I think versus the H1N1 matter, problem that you talked about, this is on a completely different scale across the globe. And we didn't have shutdowns of European countries, we didn't have borders being closed, you name it. So that's one of the issues we've had, is that given the speed it came through at and how people whether people were capable of anticipating the level of disruption that did take place in some of the supply lines. But I'll see what other orders we had in place. But there were obviously some earlier provisions that were there at certain levels for things like Brexit that we've actually been able to tap into.
If I can just slightly rephrase part of my question there, and when I spoke about pre-purchase agreements, naturally I understand the vaccine hasn't been developed, and part of that can be getting in contact with companies that we know are working on that. So has in contact with companies or perhaps made agreements, formal or informal, with companies that are in the process of trying to develop that, or an example?
I hate to say this, you just cut off in about 3 different places there. Can you just rerun that question?
My apologies. Yes, I just wanted to slightly rephrase my question there, just to be absolutely clear. With regards to the pre-purchase agreements, though the ones that I was talking about specifically are those in relation to talking to companies that might be in the process of developing a vaccine. Obviously, that isn't something we have just yet, but it can be creating a relationship with them in advance. I'm wondering, has the government looked to secure that kind of relationship already with any particular companies developing either vaccines or antiviral drugs?
Right, in terms of vaccines, the difficulty, as you've alluded to, is that we're in very, very early days, and I don't think anyone to date has actually produced, is anywhere close to having something that we can say, yes, we'd like to come and talk to you. What I can say is that at the political level, when we've been in discussions with the Ministry of Justice, for example, and we, as I've said previously, we have weekly conferences, if not more, which is a joint meeting with the other 2 Crown dependencies, is that we are, for the purposes of this, all regarded as part of the same British Isle family. And so so the expectation from that conversation is that if let's say when a vaccine is developed and the UK as a whole put their order in, the expectation is that we would be part of that ordering process. And that's essentially based on the assurances that we've had to date. We've got no reason to doubt that whatsoever. But obviously we know we're in early days of that vaccine development process. I think as that gets closer down the line, then we'll deal with that accordingly. But what we've got to make sure is that whatever one orders does have a reasonable chance of working. There have been some other references to certain other drugs, which I can't actually pronounce, but have been referred to as having some impact on treating the disease, and we do have some stocks of those on Ireland because they're already in use as for like antimalarial and I think as rheumatoid arthritis treatments. Right, if we go back to Alex, see if we can try for your second question.
Let's give it another go. Chief Minister, we heard last week that 10,000 of 50,000 immunity testing kits have arrived, and we were told before that we were receiving the first batch of 50,000 of 150,000 this week. When do you expect we'll have the capacity to test the island's whole population?
I can't give you a proper update yet. As we've said, I think we've now got to the 10 of the 50, as now 50 of the 50 are now on Ireland. Of the 150,000, which is a separate order, what we've had is some sample tests, sample kits, which again are going through the same evaluation process parallel to the order that has come across in full. In fact, and I do know, Tommy said that the US supplier is seems to be in the area of being able to provide us with some more if we need them. The objective, obviously, is to be able to, with all the comments that have been made previously around making sure this all works and it works appropriately. The objective should be that we will test in the island. Obviously, if you tested everybody now, it is likely that will be quite a large proportion that won't have it. Now, so the first, so where we are as of today, subject to the evaluation that is being completed this week, is the expectation is that we'll do a relatively limited sample test towards the end of this week and over the weekend, and that might be, I emphasise might be 1,000 or 2,000 people, and then we'll be in a position probably by the end of the following week to evaluate those initial results, and then that will give us start giving us some data around how we can then plan for dealing with the rest of the island and at what point in time. I also make the point, which I think I referred to at the press conference last week, is that we are getting some anecdotal remarks. I do emphasise again anecdote versus evidence from some of the GPs who operate in the community where they feel they might be seeing more coronavirus cases than they were expecting. So we've got this balance at the moment between the rule of thumb that we've been using up to date, that for every one case that's tested positive, we think there might be 10 out in the community. And obviously what we are very keen to try and understand is, does that rule of thumb still hold on an island in a relatively small community? Is it greater or is it less? I think provided these testing kits do work as we expect, that will start giving us some better data specific to Jersey.
Fantastic.
Okay, right, should we go for Elisa?
Hi, good afternoon, Chief Minister. Thank you. And can you hear me?
We can hear you fine at the moment.
Perfect. Elisa De Silva from BBC Radio Jersey here. I just wanted to ask, it's to do with the ethical care framework being announced. At last week's press conference, you told islanders how decisions would be made about severely ill patients and who would be given priority treatment. Obviously, we've had the announcement of the Nightingale Hospital, the announcement of the extension of the mortuary, and now the ethical framework. So why are you telling us now about ethical planning? Obviously, we've heard from Deputy Kirsten Morell saying, the timing is a bit iffy. So why are you telling us now about ethical planning? And is there an expectation that the health service will be this overwhelmed that they'll have to choose between someone who they deem fitter than the other to treat?
Right, let's, I think, step back from that slightly. Certainly the ethical framework side is one of the hardest discussions that we've had to have as ministers, full stop, and bring that together. But one of the crucial things we thought was important, and in fact I noticed one piece in the media over the weekend, I think, which was that it was important to put it out there early to allow islanders to adjust to this really quite difficult area that normally we are all quite reticent to talking about. We all hope that, I suppose at the end of the day, we all hope that none of the measures that we've had to put in place in terms of the field hospital, in terms of the ethical framework, would ever need to be used. But what we've also got to, so it's all about preparation. So we put preventative measures in place, which is things like the social distancing. That is about slowing the spread in the island. We've put the field hospital in, which is about preparing for extra capacity if we need it. And obviously then looking at other measures to look at the overall stock of beds. And the ethical framework is effectively part of that preparation. It's about being open with the public. It's saying, look, if the disease goes through the island quicker than we are able to manage, then we need to be prepared, and we've had to put those measures in place. Obviously, we're doing everything we can to try and avoid that. So I think what it is around, in this instance, let's say that the curve does actually come through worse than we were expecting. It is far better to have all those preparations in place a lot earlier, when we are in a place where we can calmly talk about these things, even though it is scary to an extent and certainly not something we're used to, versus actually we bring these things at last moment because suddenly we can see us being overwhelmed at that or overstretched at that point in time. There is never a good time to do it, but we thought earlier was better. Now, if we then can go down the line that, subject to the comments that Fiona was making earlier around actually getting the antibody testing out in place, getting all the other measures and making sure they're all there, and being clear on how the whole impact is happening on the island, if that gives us a far better picture, then we won't have had to use them. But we'd rather prepare for the worst but also plan for the best as well.
So I understand it is more to do with preparation, but as you can imagine, and as you've probably seen yourself, we're hearing a lot from islanders and even from some of the deputies that there are fears that the government are holding back from telling the whole truth. So what is the whole truth and, medical advice on the number of predicted cases in Jersey and how you think we're going to reach that curve? Are we going to be overwhelmed or, are we right on track?
As I said last week. So firstly, as far as I'm concerned, the whole truth is what we're publishing on the website, either daily or weekly. So the daily is the numbers, and you either have seen or will be about to see that we're putting the additional information out in a more extended format, because we've said we've got to the point now where we think we can at least preserve the patient confidentiality that our health professionals it's so ingrained in their system to protect that the rights of privacy to the individuals who are affected by it. So that is it's not changed in any way. That's the information we get, and they get cascaded down the system and then go out publicly. In terms of where we are, is really look at the graph that we do publish on what is now a weekly basis, and that shows where we think we are on the curve. We've had some issues, as we've said, around sampling and how that impacts on the curve. And that's why at this stage as well, it's still too early to say whether we've actually got the strategy absolutely right, whether we're doing better than we were expecting, or whether we're doing worse than expecting, because we're still at relatively low numbers. So in other words, there could be some variations in there that we don't know about. Hence, for example, my comment around the anecdotal remarks we might be getting from the GPs, because a lot of that, as we've said as well, is that on the advice we've had, there will be quite a large proportion of islanders who don't know they've had it. And that's what we've got to try and assess. And that will give us, over the next couple of weeks, we'll have a far better picture, we believe, as to where we are on the curve. And as soon as we get that, we will be publishing it. So,
can I just follow up on that question? Obviously, I know you can't test everyone all at once. I understand that, but we have the call centre, you know, the helpline, and I imagine they're recording the number of people who believe that they have the virus. So surely you should be able to sort of use that information to sort of see how much the coronavirus is spreading within the community without physically having to test everyone.
Well, actually, we're slightly ahead of you on that one. So the household survey that's been gone out to islanders, I don't have the numbers to hand, but there's at least, I think, a couple of thousand people who have responded on that so far. That is starting to give us, let's call it an indicative map of where people believe they've had symptoms, and that we're plotting. Now, it's a little bit too early again to put that information for us to make any decision based on information, but we are gathering it, and it is part of the information flow that we're trying to build up on. I go back to the point. So firstly, we're in, I think it's week 6 now, isn't it, since the first positive case. And when you actually look at what's happened and what's in that time period, as I said last week, we should, I think, be very proud of all the effort that's been put in there. There will always be things that we could have done better, I'm sure, but where we are, and we're not just looking at the UK, we are looking at European experience, we are looking at, in a wider case, where we are to date, I think is a good position. What we can't tell as yet is the speed at which it's coming through because of the low number of samples that we're getting in terms of positive cases. But in terms as well, I know particularly certain politicians love to suggest, or other individuals might love to suggest, that there's two versions of the truth. As far as we're concerned, there is one version of the truth, and we try and put that out as much as we can into the public domain.
Thank you very much.
Okay. Was that your second question, was it?
Yeah, that was.
Okay.
I've got a couple more, but obviously I know that we're restricted on time. So if we can come back to, if you can come back to me, that would be great.
You might get one more if you're very good. We'll go to Johnny Drury for 2 questions.
Afternoon, Chief Minister. Thank you very much for your time. I've got a couple of points. The first one is regarding the testing that's happening. I know the Health Minister said in a scrutiny meeting last week, I think Charlie Parker said the same thing, that 120 tests per day were being completed. Is that still the case? Is that happening daily now? And have all the health staff in the island, have they all been tested now?
I don't know status of whether all health staff have been tested, but certainly other than people basically coming to hospital with coronavirus symptoms, who we think have got a pretty good chance of having it, all the healthcare staff are the next tier down in terms of priorities. So if they haven't all had it, there is certainly an intention, as we can up the testing regime, to make sure they do get tested. But I can try and find out what proportion we've had and seek that information. The other point I do make is obviously what we would like to do is increase the level of testing. That's dependent on 2 things. One is the capacity off island, and again we have raised that with the UK last week, and if not before, about increasing that testing. At this stage, as the UK increases its testing capacity, go back to the point about all being part of the same British Isles family, there seemed to be some acceptance of that as a suggestion, but also, and it is very dependent on how quickly we can get more of those testing kits back into the island, for the PCR side. As that capacity increases on island, obviously we can then expand the number of people who we test. And it's not, by the way, I emphasise, it's not a lack of money or resources. It's purely trying to get the kit on island with all the bits to it.
Fantastic. And I know you had in your speech at the top of the press conference, you mentioned, spoke about the lockdown. You know, that's something that, and the exit strategies are something that people, you know, would like to know about. I know they said there's not a lot of data. I think we've probably been, from what we've heard, relatively successful in possibly restricting the number of cases. Can you envisage where the restrictions may be lifted sooner rather than later? And you spoke about an exit strategy, and people are working on that at the moment. Have you got a date or a target for when that blueprint or that strategy might be available to islanders, and you might be releasing that strategy?
I think at this stage, in terms of detail, we're aiming for around the end of the month. We've started the discussions, and the officials have been coming together to just, firstly to put some flesh onto where we are at present financial position, what that likely position is going forward, and then what are the economic measures that we may need to consider to help the island once we've come out of the lockdown. If we're looking at the release of the lockdown situation, that is again a discussion that, as I said, the first part we're starting to talk about at Council of Ministers later on this week. That's about just getting agreement and the input from ministers, but obviously most importantly from the medical professionals. The point I would make is that in certain jurisdictions, what they're talking, which I've alluded to as well, in certain jurisdictions, what they're calling about coming out of lockdown is actually coming to slightly closer to where we are, because they went a lot further into lockdown than we did. But obviously we started introducing the measures, certainly relative to the UK, pretty quickly. I don't have the details on me, but they were, if you take it from first positive case to when, for example, we brought the social distancing in or brought everybody in, we've moved very quickly relative to certain other jurisdictions.
That's great, thank you.
Okay, right, so I think it's Caroline joining us now from CTV.
Thank you ever so much. Just the first question is to do with staffing of the new Nightingale Hospital. I haven't heard many details on that. So how many staff is it going to need to run it efficiently? And do we know where they're coming from yet? I think in your statement you said that it had been designed that there would be fewer staff to be able to treat more patients. Are we confident that we're going to have enough staff to run it safely?
Right, the short answer is to date, yes. As I think I also said in the statement, and we'll, as soon as we get all the details together, which has been worked on this week, obviously we'll put those details out. The general principle, though, is if we work on the assumption, which is what we're having to do, that resources, do get stretched more as we go through the next few weeks. And as I said, we would all hope that doesn't get to the case, but that's what we've got to think about. Then actually making sure that the pressure on staff is eased as much as possible is important. And that, as I've said earlier, moving away from staff, that's about other resources as well. So, for example, as I said, we didn't go to the RJNHS because ambulance transfer times relative, for example, to Millbrook were a lot longer. So to use the analogy I'll apply this to staff in a minute, but if I use the analogy I used last week, if going up to the RJNHS was between 10 and 15 minutes each way, and as opposed to the Millbrook playing fields might be 2 to 3 minutes each way, ignore drop off and pick up, as it were, RJNHS is 20 to 30 minutes of ambulance time, whereas Millbrook is 5 to 10 minutes maximum. You apply that across a very busy day, and obviously we've got a finite number of ambulances and transport one can use. That means you want to, by going to Millbrook, you can use that same vehicle a lot more times for a lot more journeys. Now, you then apply that across to the Nightingale layout, which is very much open wards, and that is why, for example, hotels were not appropriate. Hotels, lots of single rooms, practical difficulties like you can't get a hospital bed into a lift, those type of things. But if it's single rooms, it's a lot more time for individual nurses and people to go and check on patients. Whereas if you've got an open plan area, effectively, in a relatively, it's a 15 by 2, so it's 30 beds in one ward. That means it's a lot easier to monitor, and therefore it's a lot less pressure on staff doing the same job, the same principle, which is monitoring the patient. That means they've got more time to actually treat a patient. Does that make sense?
That makes sense. Are you able to provide any clarity on the number of staff that are needed for the hospital?
No, as I said, that's something that's been worked up, and once that's been put together and presented to the relevant ministers, then obviously we'll see what we can put out into the public domain. I do believe we've had some very good response of people volunteering from a lot of ages, and that's something really to commend, and again to thank everybody who has come forward.
Okay, thank you. Secondly,
second question.
Yes. So you mentioned coming out of lockdown at the end of the month, and you've also said previously that you think the majority of us need to catch COVID-19 at some point, but that you don't want the health service to become overwhelmed. Can you provide an explanation of the government's strategy of how they sort of expect the majority of us to catch it, but also how coming out of lockdown, if that's won't that overwhelm the health service? That
right.
seems slightly
just to clarify, I didn't talk about coming out of lockdown at the end of the month. I talked about the if you like, the strategy around how we're going to exit from it will hopefully be by the end of the month or just after. And that's quite an important difference, because otherwise people will be looking at it and counting the days till we can all come out. Where we said that ultimately it is likely that everybody will have to catch the virus, or many people have to catch the virus, the strategy is the contain, delay, shield, which is contain it, delay its spread, and shield the vulnerable, and that's been out there for quite some time. The outcome, if you like, of the fact that virus is in the island, if you use the rule of thumb that it's for every one positive case we've had, 10 have got it at least, that would mean there's about 2,500 cases out in the island who've had it, majority of whom won't know they've had it. Now, if they've had it, it means it is still spreading through the community, and that's the point we've said about, you can go for two approaches on this. You can try and lock it down and prevent it from going any further in the island, which is what some jurisdictions have gone for. The difficulty there is that as soon as you let anybody back into the island, what some jurisdictions are seeing, they're seeing spikes essentially, and the virus surging up again. Or, and this goes back to the advice that we've had, there are various discussions around immunity and what it does, or the expectation is you let it go through the island slowly, and as people have it, the theory on the basis of the medical advice to date, and I do emphasise again, it changes from time to time, is that we will at some point have it, or majority of us will have had it, and in theory will have developed some form of immunity to it. That's based on previous experiences of flu and coronaviruses. So that isn't a strategy, that's just an outcome from the fact that it is on island and it is still spreading.
So from that, is there any concern that easing some of these lockdown measures could accelerate the rate of the spread?
Well, I think that's where the testing comes in around the antibody side. In other words, that will start giving us the indication as to how prevalent it is in the island on an evidence base, and at that point we can then start assessing. So to an extent, your question's right, but it's a little bit premature at this stage.
All right, thank you.
Okay, well, thank you, everybody. Shall we do one, I haven't looked at the time, but if we want to do one quick question each, starting with Alex.
Thank you, Chief Minister. So the UK has launched its payroll co-funding scheme.
We've lost you again.
Oh no. The UK has launched its payroll co-funding scheme today. When will more details be announced for Jersey employers?
So essentially, I'm expecting those details to be released imminently, and that means this week. I have a council of ministers after this press conference where hopefully we're finalising the details after some refinement has taken place over the last few days actually, based on some feedback from stakeholders.
Fantastic.
Okay, Fiona?
Thank you. I must apologise. It's a slightly more sensitive subject matter here. We've heard from the government, particularly as the ethical framework was launched last week, that patients diagnosed with COVID-19 will be dealt with the utmost dignity, sensitivity in their final moments and in death. But we've been getting a lot of comments today from islanders very concerned, very upset and very distressed at hearing that the temporary mortuary has been placed at Belazan.
Yeah.
So can you explain the rationale for choosing a site that's synonymous with waste disposal?
I have to say that hadn't crossed my mind. I wasn't party to the site selection process for hopefully fairly obvious reasons. That's kind of a level of operational detail I try not to get into. So I can't give you the full rationale behind it. I think it will have been around the ability to get what is basically a cold facility in place. Again, this is one of the measures that we really hope we don't need, but we've had to think about all events in preparing for the worst. There is absolutely no reference to the fact that, the past purposes of Balazan. I suspect it actually may well have been a location that was in states ownership, was vacant, depending exactly which part they're using, and it was therefore able to be used very urgently. But irrespective of where it is, we can absolutely assure everyone that everybody will be dealt with and looked after in a sensitive way as is humanly possible.
Thank you.
Thanks. Okay, should we go for Johnny first?
Thanks very much, Chief Minister. Touching on the ethical framework again, we've seen sight of an email from a politician within your government that has been very critical of the releasing of the ethical framework last week, saying it was very abrupt. The islanders weren't expecting it. There'd been no conversation beforehand, and was critical of the government for coming across with a lack of empathy really on such a sensitive subject. I just wanted to get your take on them comments and get a response from you.
Did you say a politician in the government, so either a minister or an assistant minister, or do you mean a politician not in the government but a member of the States Assembly?
No, a politician within government, either a minister or an assistant minister. Okay,
I don't think I've seen that one, at least certainly I can't recall seeing it. As I've said, certainly, and bearing in mind it was full council of ministers that signed off on the ethical framework, and as I've said, we found it probably one of the most difficult discussions we've ever had to deal with. If it was an assistant minister, they probably weren't present at that meeting. There were at least two, I believe, and so perhaps they may have misinterpreted matters. But as far as I would say, as I said, it's been a very difficult discussion for us. I think I've explained that we felt, as part of the overall preparedness scenario, it was something we needed to get out into the public arena. There is no easy way of preparing people for it. We just thought it was better to bring it out earlier rather than later.
Thanks very much.
All right, so I'm just doing it in the order on the screen, actually. So, Caroline?
Thank you. Perhaps another premature question for you, but I'd like to be ahead of the curve. Has there been any kind of thought process, or is there scope to expand the Nightingale Hospital further should we not be able to cope, should the health service become overwhelmed?
So the short answer is yes. So the present provision is 180 beds. It is potentially capable of being expanded by an extra 60, so it'll be 2 extra wards, 240. And we've also had an assessment done within the whole provision of beds within the health system, and certainly to date we believe we've got absolutely adequate capacity in terms of what's been put together. And we've also, you've also got to think of other contingencies as well. We also do speak to, obviously, the UK, and we also are inquiring from France just to see if our own preparedness still isn't sufficient, what more we need to do. So we've got to keep, as I said, it's all about preparation and hoping and planning for what could be worst case scenarios. We also hope that we don't need to use them.
Thank you. That's good.
Okay, I think the last one is Elisa.
Hi, Chief Minister, thank you. You mentioned earlier that from next week you're going to be releasing a bit more detail about your updates. So every day, obviously, we see the positive, the negative, the positive and those who've died, etc. Will we be getting more information on and about the people who've died from coronavirus?
So the information starts from today, is the release. So if you haven't had it yet, it will be coming to you pretty shortly. In terms of what we've actually given is what I kind of read out earlier. So we're doing total samples tested, people tested, results back, proportion in terms of demographics between female and male positive, average age tested positive, and then female recovered percentage, male recovered percentage, and average age recovered. We also get some details about hospital beds. Bear in mind at this stage, and again, a difficult subject, is that the number of deaths as a number is still quite small. It's still difficult for all the individual families concerned. I think we're being cautious around what we can release at this stage in terms of giving greater detail there, because there is a human being and a family behind every one of those numbers. Obviously, if that situation changes, we know we would like to give out more information if we can, but the overriding thing to date has been around the privacy levels for the individuals.
And I'm just having a look on the website because the government of Jersey did post about 11 minutes ago or so. It doesn't say the age of the people who have died, and I think that's something that islanders are quite curious about, because we're often hearing that it's mostly affecting elderly people or those with underlying health conditions, which may just be the case. But there's always speculation about different age groups who have died with the virus. So will you be saying, what type of ages of people are dying with the virus?
As I said, I think to date, because it is small numbers, and it's one of those. It's a difficult one on a small island. If you give out a particular piece of information, that sometimes allows people to start putting together a jigsaw of a picture, if that makes sense, and actually identifying the specific cases, which then is harder for the individual families concerned, who are dealing with a difficult situation anyway. So at this stage, I don't think we will be, but we have been looking at, we have tasked officers with certain other parts of information, is whether one can, for example, rather than giving numbers, perhaps put a percentage on it, for example, which might say that a certain percentage in a particular category of whatever area of data we're trying to deal with were in such and such an area, or were not in such and such an area. So I'm trying not to give an example, so you don't suddenly start saying, well, when are we going to be releasing that? But if you were to, so if you were able to say that we had 80% of such and such a category were defined as something, that might be a better way of putting the information out. Might give you and the public some greater information, but still aim to preserve that privacy aspect. That's just something we are trying to look at, and I'm expecting officers to be coming back to me, but will be, if it's this week, it'll be the end of the week, it might well be next week. I just go back to the real fundamental point. It's all about that balance between public interest and getting the information out and preserving the privacy of those people who've been affected by this horrible situation that we're in.
And can I just ask one more question? It's to do with the press release that we had today from the Jersey Community Partnership, and it's talking about local charities. So in that press release, it's saying that local charities have seen a 22% increase in demand for their services, but their funding has fallen by 55%. I understand, obviously there are, you've got funds, the Jersey Funders Group and the Bailiffs Fund, but the survey does say that most respondents, so most charities that have been a part of this survey, can't get access to this emergency funding because they don't necessarily apply, but yet a lot of their services are being used and will probably continue to be used after the worst of the outbreak as well. So what are the government doing to help these charities that are important? I mean, there's comments from Jersey Action Against Rape. That's just one of the charities that have been impacted. And they said, you know, we don't have the funds right now to make sure that we're still in existence in 3 months' time. So what's being done to help these charities that aren't considered directly affected by coronavirus, but are still helping islanders despite everything going on?
So without going to lots of detail, I'll give you a principle. And the principle is that if we know that a number of charities have been affected, because certainly if you think of the larger ones who've had charity shops, those charity shops generally are closed. Therefore, they're not getting either the donations in to then sell on, and they're not getting the ability to sell on. And so therefore their whole revenue side has taken a major tumble, which we are absolutely aware of. And so and in those instances where, for example, they employ staff to, for example, work on the tills or whatever it is, we are putting support measures in place as part of the co-funding scheme, the payroll co-funding scheme, that will be announced later this week. Now, what I can't, so that's at the high level. What I can't tell you right now, but we are aware of some of the problems that are coming through, is if you've got someone who's completely voluntary, so there's no payment at all, but in some shape or form they are struggling on that, what precise assistance we've got in place for them. But as I said, we have dealt with, as far as I'm aware, the organisations where they've got staff in place, they've got premises costs in place, and therefore we can look at seeing what assistance we can give them, particularly on their staff costs, when they've taken a noticeable hit on their revenue, on their donations, basically, or their revenue raising measures over the last few weeks, and that's being done through the payroll co-funding scheme.
So what about the charities that aren't part of the payroll co-funding scheme? What happens to them?
Well, as I said, to date, I can't give you precise details. I know we have been talking around what we do around the voluntary sector, but part of that is actually understanding what the impact is, because obviously from a voluntary sector point of view, it very much depends what their costs are that they are incurring, that they wouldn't be ordinarily covering. Now, obviously, if there are, so that's why I can't get into the details, I'm afraid, because it will depend on the individual circumstances of the charity. But we are absolutely very, very well served by charities on island, and we want to make sure that we can help them wherever we can.
Thank you very much. Thanks.
Okay, thank you. I think that probably draws things to a close. Can I just say to everyone on the radio and looking on Facebook, etc., thank you for listening and watching. From my perspective, I think we're intending to do another one of these towards the end of the week on Friday. And I look forward to the questions from the media again. And I wish you a safe week. And the message again, as we keep saying, is please keep following the guidance and please stay at home. To date, it is working and everybody is really doing well. And thank you for your support on that. And on that basis, good afternoon.